talk about the preventative benefits available now to Medicare beneficiaries that have to do with the Healthcare Reform Affordable Care Act. Prevention, doesn't that sound great?
That's what we should be doing, but there's so little of it. There may be a little smidgen here.
But what I want to know is if it really is prevention or if it's early detection, because most of it to me sounds like early detection.
Well, you're right, and a lot of it is just built into a system that doesn't work well because we're so geared on disease after it's occurred rather than disease prevention, which means that you're not going to get sick in the first place. And we start talking about a lot of these tests that are being recommended. It's really to find them early rather than it is to prevent them in the first place.
Well, I mean, it is a step. They're catching on, and I think it's great that they want to, you know, provide these tests and things to people early. And when they're in Medicare, when they really are needing these kind of things, like they're going to give them wellness examinations, annual exams, if they want them. But some of the things that they're talking about prevention are like mammograms and colonoscopies and bone scans, and those things are great and they're nice to have, but they, to me, are not prevention. They're early detection.
That's right.
So I guess it's better to catch something early than to catch it too late, but it's better to prevent it in the first place.
Well, I think what they're talking about is to give an annual exam for prevention that would be included in everybody who's in Medicare. And that's a great thing to do, but I was talking to my staff this week about that, and they said, yeah, and look at the reimbursement on it. It's really nothing. So the problem is going to be to get doctors to do one on you because they're not going to get reimbursed anywhere near what they would as if they saw you if you were sick. So it sounds like it's a really great idea, and it's a step in the right direction.
So it's great because it's free.
Well, it's not quite free. It's free to the patient, and it's not free to Medicare, but it's also not a great thing for doctors in terms of making an income.
Well, I was reading that they're sending letters to doctors to encourage prevention with their patients, so that's a good thing.
Well, I think that there are moves in the right direction. Maybe Michelle Obama's doing more than anybody else.
With her Move On?
Yeah, and, you know, eat well, the organic foods, and she's got a garden now at the White House, and to do something about obesity so that we can, you know, start exercising and doing the things that we can to prevent these things from happening.
And to start where it's really important with children.
Sure. When you look at people who are in the Medicare age range, 70% of everybody on Medicare has at least one chronic disease. And nearly 40% have 2 to 4 diseases, chronic diseases that are serious. And there are about 7% that actually have 5 diseases or more. And we're filling in the range of 50 prescriptions a year, either of new medications or refills. And we're seeing an average of 14 different kinds of doctors. That is not
per patient. This is all per patient.
Per patient. So we're not looking at exactly a wellness model here. We're looking at a model that's steeped in diseases and in treating them, and the basis for that has to do a lot with economics. You wonder why we don't really have a preventive healthcare system in America. It's pretty straightforward, because if we did, we'd probably be close to bankrupt. The $2.5 trillion a year that's ever rising and skyrocketing is what is making our economy move, and that's why we have 18% of the gross national product being spent on healthcare benefits now. So if we did something to lower that, we'd get rid of a lot of jobs. The economy would not be shifting as much money through it, so that there would be a lot of income for the state governments and the local governments and for the federal government, and we'd have a bigger recession, and that seems to be the biggest interest that this country has at this moment.
So it's a conflict of interest for our economy, for people to be healthy and to really
That's a nice way to say it, and it sounds outrageous. You would think at least the insurance companies might want to do something, particularly those new insurance companies who could find a niche in the market for prevention and to have policies for prevention. But think of it this way. Why would an insurance company want everybody to be healthy?
Because then they don't have to pay the money for their health problems.
That would be true, but let's say that you spent $100 a year on health care, okay? And the insurance company would get 25% of that. They would get $25. Mm-hmm. If the expenses were $25 billion, right, then they would get the same percent, or $100 billion, they would make $25 billion. Okay. So the only way they can make money is if you're sick. if you're healthy, yeah, they don't have expenses, but
Well,
they also don't have
How do they
income.
make the money?
You're paying your premiums at a much higher level if you're sick. So the more people that are sick,
I thought we were getting rid of that.
we're not
But you
getting
were
rid of
going
it.
to be penalized for being sick and having to pay more.
No, what you're not understanding, Vicki, is what a lot of people don't understand. And that's it. It's that insurance companies make more money when you're sick because they can charge you more for their insurance premiums. If you only spend $100 a year and they make 25% of it, they make $25 off of you. Mm-hmm. If you spend $100,000 a year, they make $25,000 a year. Do you see now what I'm talking about?
No.
It's based on how much money comes through the system. And that's why we don't have insurance companies like that. And you also similarly couldn't expect Big Pharma to want to do something in prevention because they want to sell what?
Drugs.
And if they're going to sell drugs, they're going to make return on investment. And that's what it's all about.
Well, this all sounds pretty discouraging.
Well, if we wake up to it and we begin to realize how we're being used and manipulated, maybe we'll wake up enough that we'll say, maybe we shouldn't be using the mantra of the Greyhound Bus Company for the doctors when they say just leave the driving to us.
And we'll show you we'll be healthy.
Exactly. Okay, so if we're healthy and taking care of ourselves, we don't need a sick care
If they
system.
let us be healthy, because it's difficult to be healthy with all the toxins in our environment. We're being contaminated all the time,
That's
as well
part
as
of
our
it.
food.
But look at the positive things you can do. You can exercise regularly. You can eat healthy food. You could grow your own food. You could reduce your stress levels. You could watch your weight. You could make sure that you're having a life that is fulfilling. Those things you can do, and those are very, very important factors.
And that's not all real easy either, because they're contaminating the air that we breathe, the water we drink,
That's
the
true.
food we eat.
Okay, but let's stay positive here. What can you do is what I'm asking. And it's a lot. And you can change around the amount of disease you have. If you're going to take a negative attitude about it and say, well, it's hopeless, I can't do anything because we're all being poisoned anyway, then you're a double loser.
But by saying those things, I'm not saying that we can't do something about it. We can stand up for our rights, and
That's
we can
right.
stand up for organic food. We can try to get rid of genetically engineered
Exactly.
food. We can try to control the toxins that are going into
There
our
you go.
environment. Look
There
at
you
what
go.
happened, like with Japan and all this nuclear
Exactly.
contamination. I mean, maybe we could get rid of dirty electricity.
Well, there are a lot of
nuclear
things.
plants.
There are a lot of things we could do that are positive. I agree with you.
And not be having big ships taking oil on our oceans and leaking it and killing the fish and our wildlife.
well,
Maybe we could do something on that end of it. That's where we need to focus on for prevention.
Well, the government needs to do that, but the
Yeah.
government is not going to do that. So the question I ask you then is, what can you do? And the answer to that is,
Write letters to our congresspeople.
yeah, well, you can do that. Waste your time. They don't even hardly read them. What you can do is you can eat right the best you can. You can exercise every day. You can reduce your stress. You can make sure you get enough sleep.
Because if you don't, then you're going to have an even bigger toxic load. Because
Well,
when
those
you're
are the-
exercising, you are detoxifying.
But those are the things you can do.
Yeah.
So you want to keep positive. And you want to know what
Sorry.
you keep. Well, no, you don't be sorry. Because you're making some good points here. And I agree with them for sure. But we're talking about prevention like we are with the Affordable Care Act. Give me a break. I mean, it's a baby step in the right direction. And I don't want to put that down completely. But I sure don't think that it's the whole story. America has to wake up. We have to start taking that responsibility ourselves. We can't put it on our doctors or the pharmaceutical industry or the government because they've already told us what they're going to do. Not much. You got a little wellness exam here once a year, and that's supposed to be prevention. And then they start talking to you about other things that they recommend that are debatable. I mean, do you really need a mammogram when you're under age 50? Do you need a colonoscopy really?
Do you need a PSA even?
Well, right. Do you? I mean, these are all things that are very debatable. And until we have good, solid answers there, we're just moving in a direction that's flowing with the current. It's not like we're taking responsibility ourselves as citizens and saying, we've had enough. We're not going to depend on the government. We're not going to depend on Big Pharma or the insurance industry. We're not even going to depend on the medical profession. We're going to depend on our common sense.
And ourselves.
Yes, exactly. And all these things will happen. if we start changing the way we live our lives and the way we think, the stuff you're talking about becomes really important. Environmental pollution's huge, and I commend you for bringing it up, because I think it's a very, very important aspect of why people are getting sick.
And the first thing comes with awareness of what's wrong.
Exactly.
Before we can change anything, we have to be aware of it, and we have to be educated about it.
Exactly. So thank you, Medicare, for making a tiny baby step in the right direction. Now let's do our work ourselves. If we can do the work ourselves, and we can start taking personal responsibility, nobody can stop us from making certain kinds of improvement that can make a big difference in how healthy we are.